welcome to RT World. Once again, my name is Mr. Cates. All right, so if you're here for the chest x-ray. Well, this is actually a part 2 video. So we did a part 1 video. That's more of interpreting chest x-rays. You get x-rays and you need to see some landmarks and some key terms. That's it. This is more of a descriptive part 2 video to the chest x-ray radiograph video that we did. And like I said, this is a descriptive interpretation, and we also are going to include some treatments. So once we interpret a film or we see descriptive language in a test, board exam, therapist multiple choice, or a clinical simulation exam, or whatever that may be, they might be using descriptive terms. So we did a part 2 to kind of break that down, and then also we can combine this with the part 1 video, and then we can also get some treatments along with some things that we have listed here on the side. And that is a clue for today's video. We are going to cover chest x-ray descriptions, interpretation, and treatment, but we're going to stay in the lines of these right here. These are the most common in our RT world, right? And that is pulmonary edema, atelectasis, ARDS or IRDS, pleural effusion, pneumonia, pulmonary embolus, and tuberculosis. All right, so we're going to get started. We're going to go in this order here, guys. And remember, there is a part 1, so if you want to look at this, you want to look at landmarks and all that, I highly suggest you watch that video before you start breaking down this video. All right, so let's get started. First thing on our list is pulmonary edema. So pulmonary edema, guys, right? We're going to see this in descriptive language, and I'm going to do the descriptive language right here. So when we see this, this is what we can kind of see. We'll see descriptive language as, you know, fluffy infiltrates, right? Okay. We also will see stuff like butterfly pattern. Okay, this is descriptive terms. They're leading you for pulmonary edema. We also see this, which is bat wing pattern. Okay. And those are 3 descriptive terms that they will use for pulmonary edema. They could say fluffy infiltrates, leading you to pulmonary edema. They could ask you butterfly, or you read butterfly pattern or bat wing pattern, and that is leading you to pulmonary edema. All right, so we know what it is. We got the descriptive language. We already identified it's pulmonary edema when they give us one of these. Well, now we're going to go to the next. So we are getting descriptive. Now, descriptions, interpretations. We did that. Descriptions, interpretation. Now our treatment. And our treatment for pulmonary edema is, there's 1 or 2 things. Number 1, and that is what? Diuretics, guys. Diuretics. And what is that? Basically water, to eliminate water or fluid, right? We eliminate by urination. So we give a diuretic. And that diuretic is very common. You should hear of this. And this is Lasix. Also another term for this is furosemide, right? Furosemide, okay? All right, those are what you could see. Lasix, furosemide, guys. Those are diuretics, and that's what we want to give for pulmonary edema to get rid of some of that fluid. All right? Now, number 2, this is positive inotropic, right, agents, okay? And what is that? What is positive inotropic agents? Basically, what these do is these increase myocardial strength contraction. So the strength of that heart contraction is stronger when you give positive inotropic agents. And some of those positive inotropic agents that you might see or that we want to recommend, if that's what they're trying to do, recommend for this, and you get pulmonary edema, you should recommend a positive, right, inotropic agent, because we want to increase the what? The strength of that contraction, okay? And some of those things that you could see are, okay, and this would be what they call dig or digitalis, okay? Okay? Or digoxin, okay? Those are a couple that you'd see, and those are the most common ones. So digitalis and digoxin are positive inotropic agents. And remember, what is that again? Strength of contraction, right? It increases the strength of your myocardial, which is your heart muscle contraction. All right, so pulmonary edema, we identified that by seeing one of these terms, descriptive terms. Now we know how to treat it. Diuretics, positive inotropic agents, right? Okay, pulmonary edema, CHF. What else are we going to give? We give positive pressure, right? More PEEP, oxygenation. It's another thing we could talk about, right? So let's stay in lines of this or treatments. All right, let's go to the next one. Atelectasis. Is there anything on atelectasis that we might see descriptive-wise? For sure there is. In atelectasis, this one's a little bit easier because this one, we only have one for atelectasis. And this one is patchy. Patchy infiltrates. Okay? And if we see patchy infiltrates, we know we might be dealing with, or we know that we're dealing with atelectasis. All right? And really, with atelectasis, the treatment is lung expansion therapy. Okay? Lung expansion therapy. And when we say that, what are we talking about? IPPB, CPAP, and PEEP. That's our lung expansion therapy. When we have atelectasis or we see patchy infiltrates written down, we need to give PEEP, CPAP, IPP, some type of lung expansion therapy. All right? That's atelectasis. Now we do move down to ARDS. And now with ARDS, guys, right, we have some very descriptive terms you might have seen. And that is ground glass, okay, or honeycomb, okay, and this one, or diffuse, scattered. Bilat means both sides, bilateral, both sides. And then this one, radio, remember, and if you watch video 1, you'll know about these terms about diffuse and radio opacity. That means you can't see through it, right? ARDS, honeycomb. If you go watch that video, you'll see what that honeycomb or that complete whiteout looks like, right? Bilateral, radio opacity. You can't see, right? Radio opaque. You can't see through. Key terms, ground glass, honeycomb, diffuse bilateral, ARDS or IRDS, guys. All right? And the next one we are going to see, this one's more of, we described this in the first videos, it's pleural effusion. All right? And pleural effusion, we're going to see blunting. Right? And what are we talking about blunting? We're talking about what? Our costophrenic angles, right? They're going to be filled with fluid. Okay? Costophrenic angles, blunting of those costophrenic angles, guys. Okay? All right? Pleural effusion. And we talked about what's our treatment. We have another video out there for that. And our treatment for this is going to be one of the, what? Thoracentesis. All right, chest tube. Okay. Okay, antibiotics. Once we know what takes care of it, right? Okay. And our number one, most common, we talked about in that other video, is going to be thoracentesis. Remember, exudate, transudate, clear fluid, or we send it in. We can give some antibiotics, right? And the last one here we won't want to forget is steroids. So, inflammation, guys. All right. So, pleural effusion, blunting of the costophrenic angles, right? You know you're leading down some type of fluid that's going in there. What should we do? Well, recommend a thoracentesis, most common, right? We can also do a chest tube or antibiotics or, you know, obviously put some steroids for inflammation, okay? All right? And the next one on the list, this is pneumonia. And on pneumonia, guys, we are looking for, what are we looking for on pneumonia? What do you think? Okay, this one's very, very specific, guys. This one is air bronchogram. Okay, you see air bronchogram, you know you got pneumonia going on. All right, and what do you do for treatment? It's right here. What do we do for antibiotics, guys? Antibiotics. So we're going to culture and sensitivity to that. We're going to see what it's sensitive once we identify the bacteria or viral or whatever we're dealing with. Pneumonias come in different ways, right? Once we can identify that, and that's later videos, you can see how we get to that level. But once we get that, we need to apply some antibiotics, if it's bacterial or not, right? We need to figure out what's going on. That's our sensitivity. All right. So now we go down to pulmonary embolus, right? Pulmonary embolus, guys. Okay. So on this one, we are looking for wedge. See, wedged shape. Infiltrate. These are very specific. When you see those, they're leading you to pulmonary wedge shape infiltrates. I'm reading that in my descriptive or my question. I see that. Very descriptive. It's leading me right to pulmonary embolus, guys. Wedge-shaped infiltrates. All right? And with this, what do we do with this? Well, we need to, it's clot, right? So what do we do with clots? Right? What are we going to give? Heparin, right? Blood thinner, clots. We're going to break that down. Okay? So heparin is a choice. Another choice that we have is this right here. Streptokinase. Streptokinase. This is used to dissolve the blood. So what is this? Streptokinase is used to dissolve the blood clots that have formed in the blood vessels, right? And this is to what? Pulmonary emboli, embolus, guys, embolism, right? Also, what else? This is for DVT. What is DVT? Deep venous thrombosis. Right? This helps break down the clots. So heparin or streptokinase, and this is DVTs, blood clots, helps break that down. Very important, guys. Keep this. Okay? And let's get to our last thing on our list here, which is tuberculosis or TB. Okay? And on TB, you need to see this word. If you see something that says cavity forming or cavity formation, something like that, that a cavity is formed, or there's a cavity that's formed when they're talking about chest x-ray descriptive terms, right? If you see cavity formation, they are leading you to suspect tuberculosis, all right? And this one here, this is see that anti-tubercular, right? And these are agents. What are these? These stop the growth. That's what anti-tubercular medications do. They stop the growth of the bacteria that causes TB. So what this is doing, the treatment anti-tubercular, is stopping the growth of that TB. So you're stopping it from continuing or moving or reproducing, right? So we want to give that kind of medication. All right, guys, so, and like I said, in today's video, this is actually a part 2. But I think we got a lot covered over here. And if you can see this in descriptive terminology, not just seeing a chest x-ray and identifying landmarks that we talked about in the beginning, but you might see some of these terminologies written down. And when you do, now you also see what we need to do to treat that, highlighted in green on the outside. So look at the blue here and identify these are things that are going to tell the pink what this says. If we get fluffy infiltrates, we know, you see it right here, pulmonary edema. Very easy. If we can dial those in, you should be able to zero right in to where they're leading you. What disease pathology are they getting to, right? And that is a very important thing. That's why we broke this up into two sections. Because chest x-rays and radiograph, there's a lot to unpack, especially for a respiratory therapist, right? We got a lot going on. We need to know a lot. We need as much information as we can get. So we can get this solidified and we can memorize this stuff, and when we see it, we know exactly where to go. So again, we look forward to seeing you in the next video.